Good afternoon, everyone, and welcome to today's AfriSummit webinar on global perspectives on self-care and OTC regulation. I'm Anna, and I'm delighted to speak on behalf of the AfriSummit team. And today's webinar is in collaboration with our valued partner, Haleon, and I'm sure it promises insightful perspectives and meaningful dialogue. We're thrilled to be hosting today's session with them as their continued partnership helps us deliver high-impact content throughout the AfriSummit experience. This year, we have AfriSummit happening from the 2nd to the 5th of November at the Hilton Grand Nile Hotel in Cairo, Egypt, and we'd be happy for you to join us both on site or online. For those of us joining for the first time, AfriSummit is Africa's leading platform, bringing together regulatory authorities, industry experts, and healthcare professionals, and we strengthen the consistency of pharmaceutical and medical device ecosystem through collaboration, innovation, and knowledge exchange. But to steer into our conversation now, I'd like to introduce Ramez from Haleon to take over the discussion and do the round of introductions, as well as to start our dialogue. Ramez, the floor is yours. Please hang on.
Thank you, and good afternoon to all joining us from across the Africa region. It's really a pleasure to welcome you to this special pre-event webinar ahead of the 5th PharmaReg AfriSummit. At Haleon, we believe self-care is one of the most powerful enablers of healthier lives. And today we have the opportunity to look at it through the lens of regulations. Regulations can either unlock access to safe, effective self-care solutions or unintentionally create barriers. That's why we brought together some of the most respected voices in this space to share insights, experiences, and best practices. I'm especially pleased to welcome Christina Gkouva from PAGB, the UK's leading consumer healthcare association, and my colleague Aurélie Farfaro, who leads the European Regulatory Strategy and Innovation team for Haleon. We hope this discussion will give you practical takeaways that can be applied in your markets to help people take charge of their health. And with that, I will hand over to Aurélie to set the scene and start our conversation. Over to you, Aurélie.
Thank you very much, Ramez. And it's a pleasure to join colleagues and regulators from across Africa today. So when we talk about regulation, it can sometimes sound very technical, but at its heart, regulation of OTC medicines is about people's lives. It's about whether a mother can access safe medicine for a child without spending hours in clinic. It's about whether a worker with seasonal allergies can treat himself and keep contributing to his job. It is about whether older people can manage their daily health confidently without unnecessary strain on healthcare systems. And in the UK and in Europe, regulation of OTC medicines has made many of these scenarios possible, allowing millions of people to take care of everyday conditions safely, affordably, and with confidence. Of course, no regulatory model can ever be considered finished. There is always more to keep pace with new science, consumer expectations, more to modernize, adapt as healthcare system changes. And I think this is something that unites all of us globally. While every market is unique, we hope today's discussion will show how some of these principles could inspire approaches in Africa. So as mentioned by Ramez, I will moderate this dialogue, asking questions that I think are very relevant for you. And we will have a Q&A at the end. So please use the Q&A button to post your questions throughout the discussion. Okay, so I think now it's time to hear from Christina. So let's go ahead. And Christina, maybe you could start with briefly introducing PAGB and its role in shaping the UK's self-care and OTC regulatory landscape.
Yes, absolutely. And good afternoon, everyone. And hi, Aurélie, and hi, Ramez. And thank you very much. And thank you very much for the opportunity to be here. So yes, a brief background about PAGB and who we are and what we do. So PAGB is the UK's trade association for manufacturers of over-the-counter medicines, self-care medical devices and food supplements. And we are the only trade association in the UK that covers all of these three categories. So we currently represent 98% of the branded OTC medicine sector, covering all major household brands that people know and trust, including Haleon. So we were founded over 100 years ago, and from the beginning we've acted as the industry's self-regulatory body. So we wanted to set the standards to make sure that self-care products are marketed and advertised in a balanced and responsible way. However, today our role is even broader. We are the expert voice of the UK consumer healthcare industry, and we work closely with the government, the UK medicines regulator, which is also known as MHRA. We work really closely with the Department of Health and Social Care in the UK, and of course our members, in order to help the sector navigate this ever-changing regulatory landscape in a very responsible way. And some examples of how we can make this happen. So first of all, we can actively contribute to regulatory policy development. So we provide expert input on consultations and help save guidance on areas like, for instance, reclassification, product naming, umbrella branding, advertising as well. And we also produce our own guidance documents and training material to support our members in making sure that they apply all the rules correctly and consistently. Of course, being in the UK, Brexit was a major focus for us. So throughout that period, we worked really close with the government, with MHRA and our members to minimize disruption, to save post-Brexit rules, and of course, secure supply continuity, which is really important. And last but not least, we also engage in a continuous advocacy and communication work in order to advance the self-care agenda. So actually, we are really pleased that earlier this year, thanks to our campaigning efforts, we secured explicit recognition of self-care and OTC medicines in the government's flagship health policy document, which is called the 10-year plan. So this is in a nutshell who we are and what we do at PAGB.
And if I may, I really would like to commend the fantastic work that PAGB is doing in the UK for self-care, and definitely the strong relationship with the UK regulator, the MHRA. So I guess now, Christina, in your view, why is self-care so important in today's healthcare systems?
Well, yes, absolutely. Self-care and over-the-counter medicines are a vital part of the health ecosystem in every single country, including in the UK. So first of all, self-care empowers people by enabling them to treat the symptoms of self-treatable conditions appropriately and effectively. And it also protects vital resources within the health systems by reducing unnecessary doctor's appointments and, of course, like emergency hospital visits as well. So the scale of this is huge, and I actually prepared a couple of slides because I would like to take you through some work that we did. So back in 2023, we commissioned research that showed that actually in the UK, 64 million people will experience at least one self-treatable condition per year, as you can see on the slides. And out of this, 61 million people will use OTCs to manage their self-treatable condition. So this enables individuals to work an additional 5 days per year. For example, if they don't have to take unnecessary sick leave. So in fact, in the UK, we have 983 million OTC products, which are sold annually in the UK, helping people to self-care at home. Just to clarify that in the UK, when I'm talking about OTC medicines, I'm talking about products that can be bought under the supervision of a pharmacist in a pharmacy, but some OTC products are also available in other settings, for example, like supermarkets as well. But I would like to talk a little bit more about the economic impact, which is actually really striking. Can you go to the next slide, please? So in the UK, the OTC sector saves the national health system, the famous NHS, £6.4 billion every year in prescription and appointment costs. And if policymakers were to fully embrace the opportunities of self-care, that saving could grow by a further £3.1 billion. And the next slide, please. Thank you. With 1.7 billion pounds from greater use of existing OTC products, but there is also 1 billion pounds, as you can see here on the slides, from further reclassification opportunities of prescription-only medicines. And that would mean potentially eliminating 25 million unnecessary doctor appointments and 5 million avoidable emergency hospital visits every single year. And this isn't just a UK story. So the Global Self-Care Federation, which is our global counterpart, has shown that the current self-care activities already generate at least $119 billion in global savings annually. And that covers both financial terms and healthcare workforce capacity as well. So just to summarize, when we talk about self-care, we're talking about something that improves patient and consumer outcomes. It empowers individuals, but also delivers substantial savings for health systems which are under pressure across the world.
Yeah, so we've seen how important self-care is for healthcare systems and its economic impact, right, with so many savings. So ensuring that OTC products are registered and available is critical. And I guess that brings us to the registration process for OTC molecules. And so, Christina, I think it would be great to hear from you on how does the UK streamline registration processes for OTC molecules.
Yes, absolutely. Can I have the next slide, please? So just to bring everything under perspective. So in the UK, we have our medicines are classified into three main categories, as you can see here on the slide. And the classification is basically how they can be supplied to the public. So as you can see, first we have the prescription-only medicines that have to be prescribed by a doctor and have to be dispensed from pharmacy. And this is your commonly known RX medicine. We also have the P medicine that can be bought only from pharmacies under a pharmacist supervision. And then we have a third category, which is called the general sale list or GSL. It may be bought from retail stores, so for example, a supermarket or a news agents in the UK. So the P and the GSL categories together make what we call the over-the-counter OTC medicines in the UK. So when we talk about streamlining the registration of OTC medicines, I think that we are talking about the reclassification process, which is actually means how we can move products more from the RX and POM section towards the P, GSL, and the self-care area. So in the UK, MHRA, which is our UK medicines regulator, has actually introduced structured pathways for reclassification, including a detailed guidance. We also have a flow diagram that actually shows you the different pathways and potential reclassification routes that the medicine can take depending on its classification and the reclassification process. And we also have a validation checklists. So you can see that all of these documents together make the process more predictable and more efficient for companies as well. In addition to that, MHRA strongly recommends that when applicants are submitting major reclassification, so when we're talking about an ingredient that has never been available OTC, let's say, beforehand, that they should seek scientific advice meetings. We call them SAMs. So SAMs can address like different issues. So you can talk to the regulator about, for example, like different supply conditions, your patient population, for example, different potential changes in your product information when you're making available the product OTC, the different product names that you might want to explore, and the different submission strategies as well. Of course, these meetings are not for free. They are at an additional fee. However, they are really valuable when it comes to project planning, especially, again, particularly for innovative reclassification and switches as well. So as PAGB, we work closely with the MHRA in developing this guidance for the industry, and we also continue to work with the regulator to optimize the process where suitable. And we have also developed our own guidance and our own training material as well, to making sure that we provide our members a little bit more industry focused training as well. So apart from streamlined pathways, I believe that collaboration is also another key part of the UK model. So in the UK, there was actually work previously undertaken on reclassification back in 2001, so a while ago, by a collaboration called the Reclassification Alliance, which brought together the government, the industry representatives, the regulator, but also pharmacy associations as well. And this alliance actually facilitated 50 reclassifications. And as a result now, the UK has over 150 actives available over the counter. So this is actually really significant because we believe this is the most in Europe. So thanks to this work, actually, all OTC medicines can now be advertised as well, which is also really important. So that collaborative effort, which PAGB played a big role, has recently been revitalized. And if I can have next slide, please. Thank you. Leading in the identification of 6 priority health areas, as you can see on the slide, where further reclassifications could safely expand access. So we have short-term sleep aids, we have oral health, we have pain management with the focus of migraine, osteoarthritis, pain relief and joint pain. We have the area of allergic rhinitis. Skin is also really important with the focus of acne, eczema, psoriasis, and of course, women's health. So overall, as you can see, I wanted to pull the 2 key points that I thought that they were really, really important when it comes to reclassification pathways. And I believe that the UK's approach combined structured regulation, which is really important, with partnerships, which is also equally important across different stakeholders, making it faster and more predictable to bring trusted OTC medicines to the market. And of course, as a result, empowering patients to take greater control of their own health. Actually, in a recent survey that was published by PAGB, 74% of the adults in the UK agree that more medicines should be available OTC. So we know that this is also what people want as well.
Yeah, thank you, Christina. And similarly in Europe, even if classification categories can slightly differ from one member state to another, what is common for all and really critical, I think, for both regulators and marketing authorization holders is to have a clear definition for OTC medicine, right? And well-defined and transparent classification criteria written down in a specific guidance document. And we see that really well in UK and in Europe. Collaboration in some EU member states, I think, can be improved. We should also follow the UK example here. So more to come. So I guess now it would be great to hear from you about the main benefits regulators and consumers could see from these streamlined pathways.
Yes, absolutely. So first, let's take it from the regulatory and the industry perspective. So these streamlined pathways create predictable and transparent process for submissions, which is key. So this will allow companies to prepare and complete and high quality submissions, and it will also reduce the need for additional data requests and actually will make the overall process and experience, if I might say, more smooth and more efficient. Predictability also encourages greater industry investment and confidence to pursue the reclassification opportunities, because sometimes reclassification costs money, they're not cheap. And in turn, that means that new products can actually reach the market faster, benefiting both the public health and the wider healthcare system. So this is the industry perspective. When I think about the consumers and public health, of course, the advantages are pretty clear. We have, first of all, rapid and convenient access, as people can obtain effective treatments quickly, often outside normal doctor's hours. For example, like pharmacies are highly accessible here in the UK. Consumers also have greater autonomy and choice, because as we know, self-care empowers individuals to manage their health confidently and responsibly. And we also have free pricing. So OTC medicines in the UK are not subject to NHS pricing, allowing market competition that could potentially result in affordable options as well. And last but not least, when we talk about the regulators and the health systems, I believe that streamlined pathways can help, of course, first of all, reduce the additional workload, allowing regulators to focus resources on higher risk products that need potentially more scrutiny than OTC products. It also reduces pressures on hospital services, as more conditions can be managed safely with OTC treatments potentially at home. It also prevents escalation of minor ailments as well, because we support early intervention, of course, and then as a result, we have better outcomes. And finally, as I previously mentioned, reclassification contributes to significant cost savings within the healthcare system. So I believe that overall, streamlined pathways represent a win-win across the board. So they encourage innovation, they improve access, and support sustainable healthcare by promoting safe and effective self-care.
Yeah, thank you, Christina. On the pricing of OTC medicines, in the UK, right, it's pretty priced. And I would like to add that the underlying belief behind OTC price regulation is that if unregulated, OTC prices will rise and make medicines unaffordable for low income and vulnerable populations. But we see a competitive marketplace provides choice, you mentioned, for consumers, right, and help keep prices down. And if the consumer does not wish to pay for a product, there are always alternatives in the non-prescription sector. And in Europe, the EU Commission has stated that member states should remove price controls on manufacturers that prevent full competition of authorized medicines, especially for those that are neither purchased nor reimbursed by the member state. So that's what's happening in the UK and in Europe. So how could similar principles be applied in emerging markets like those in Africa? Could you share your perspective?
Yes, emerging markets can adopt a collaborative and data-driven and streamlined regulatory approaches to safely expand to OTC medicines. So we are talking much more like the model that is already being used in the UK. So as I mentioned, a great example is the UK Reclassification Alliance, which brought together all the different stakeholders to identify and prioritize medicines suitable for OTC use. A similar approach, a similar alliance in African markets, for example, involving the Ministry of Health, national authorities, regulatory bodies, industry representatives, and pharmacy groups could help ensure alignment, shared vision, shared goals, and efficient decision-making as well. Of course, developing step-by-step clear regulatory pathways with supported by guidance documents, ideally flowcharts, guidance, validation checklists, the whole lot, would help companies navigate the process with confidence and clarity, while ensuring there is consistency in their approach and their applications. Another interesting point is involving the public health and healthcare professionals in consultations, which could also help to build trust among different stakeholders and actually ensure that reclassification, this specific reclassification is appropriate for local healthcare contexts. And we have some examples in the UK that actually that happened as well. Another point is about risk management measures, which I believe they are also equally important. So for instance, in the UK, we provide training for pharmacists And we also use standardized checklists during a pharmacy and patient interaction to make sure that medicines are supplied safely and appropriately as well. So in addition to that, of course, maintaining routine pharmacovigilance systems allows the early detection of any safety concerns. However, I would like to mention that it is worth mentioning that globally, experience shows that newly switched OTC medicines have an excellent safety record when proper safeguards are in place. So I believe that by applying all of these principles, African markets could improve access to safe and effective self-care options. They can also strengthen the local pharmacy practice as well and reduce pressure on healthcare systems, which we know that they are overstretched across the world. And in parallel, they are empowering people to take care and control of their own health as well.
If I summarize in a couple of words, collaboration is key, right? And I agree with you. Even though we can see great collaboration in many markets, I think the UK is indeed seen as a best practice with very pragmatic approaches. And the high number of available OTC molecules is a testament to that. So it would be great if you could please share some of those notable examples of successful RX to OTC switches in the UK, letting us know what were the critical factors for success in these cases, and how does PAGB collaborate with government agencies, healthcare professionals, and industry to drive regulatory change?
Yes. So first of all, I would like to take you back in 1983 when ibuprofen were first reclassified in the UK, making it the first medicine available without a prescription. So you can imagine, since then, ibuprofen has become one of the most frequently purchased over-the-counter medicines that provide people a convenient and effective way to manage their pain, fever, and when appropriate to do so without needing the NHS. So this is our first example of a switch in the UK. So in addition to ibuprofen, I wanted to share two more examples about successful RX to OTC switches. So the one is sildenafil for erectile dysfunction, and the second one is a low-dose vaginal estradiol product for menopause symptoms. So let's start with sildenafil. So back in 2017, a few years back, MHRA reclassified a specific product containing sildenafil 50 milligrams from the POM section, from prescription only, to the pharmacy status. So this actually allowed men aged 18 and over with erectile dysfunction to purchase it directly from a pharmacist following a consultation. However, we still have restrictions. For example, it is not available for people with certain health conditions. If, for example, there is a cardiovascular risk, if there's a kidney or a liver issue as well. Or there is restrictions with people who are taking other medicines as well, as you can imagine. And of course, just to caveat that higher doses and different strengths still remain under the prescription-only status, because in the UK, reclassification applies only to the specific product. So only this specific product was under the pharmacy-only route. So it is not a free-for-all. Reclassification does not mean free-for-all. So this example of reclassification balanced access and safety. And pharmacists actually played a key role in assessing the contraindications, for example, as I mentioned before, the severe cardiovascular disease or certain drug interaction. And then they could also further refer the patient to the doctor if needed. In addition to that, the very interesting point in this specific case was that this switch actually addressed several public health priorities as well, which I would like to take you through. So the first one is improved access and convenience. So now we have men that can obtain a proven treatment without going to see the doctor, which helps those that they are reluctant to discuss erectile dysfunction because they will consider it to be stigma or embarrassment or a taboo. The second point, which is really interesting, is that the reduced use of counterfeit and unregulated medicines. So by providing a safe and pharmacy-based route, actually this switch helped limit purchases of unsafe online sources, which is really important. And MHRA actually highlighted that as a really big win when they announced the reclassification of this product. And of course, it encouraged health engagement. So, as I mentioned before, like the product had to be supplied by a pharmacist after a consultation. So this specific route, this specific pharmacist consultations open opportunities to discuss wider health issues with the patient. So, for example, they talk about smoking, weight, alcohol, or even cardiovascular risk, which is a really important public health benefit. And last but not least, since erectile dysfunction can be an early warning of a cardiovascular disease, of diabetes, or even hypertension, so by going to the pharmacist, it actually created a valuable health check moment for men's health. So this is also really important. So this is the first example that I wanted to share. The second one is the reclassification of the hormone replacement therapy, which we call it HRT, low-dose estradiol vaginal product, which is for postmenopausal women. So this specific product, so low-dose vaginal estradiol, has been widely used in the 90s, since 1991 on prescription. And actually, in response to data submitted by a pharmaceutical company highlighting the potential benefits of reclassifying estradiol, MHRA undertook an assessment of the product, resulting in a public consultation. This is what I was referring earlier. So in 2022, lasting several months. But actually, this public consultation, it was a really useful experience and exercise because it included input from the Royal College of Obstetricians and Gynecologists, the College of Sexual and Reproductive Healthcare, and the British Menopause Society. So following the assessment's conclusion, our regulator, MHRA, decided to reclassify this specific estradiol product to a pharmacy medicine, again, as a P medicine. So this decision was described by MHRA as a landmark moment for women's health, establishing and enabling millions of women to access effective and local HRT treatment directly from pharmacies. So, and according to MHRA, it gave women greater autonomy, reduced barriers to care, and of course, relieved pressure on health services as well. So I believe these two examples, including ibuprofen was the first, which in the UK actually gave you an idea of the benefits of reclassification, but also the different safeguards that we take here in the UK to make sure that medicines are still supplied safely.
Wow, these are really great examples. Thank you, Christina. So before my final question, can I remind everyone to post their questions in the Q&A? We would love to hear from all of you and take as many questions as possible. So please do use the opportunity and post your questions in the Q&A. Right, Christina, we talked about benefits, and there is sometimes a belief that OTC medicines can bring greater risks. So it would be great to understand, how do you manage potential risks such as inappropriate use or misinformation post-switch?
Mm-hmm. So yes, managing risks after a product has been reclassified is about taking a comprehensive but also proactive approach that could combine, for example, a strong regulatory foundation. Pharmacy practice as well is really important. So by providing pharmacies the appropriate tools, it also requires continued monitoring as well and clear communication. So I believe that it all starts with a robust summary of product characteristics, so what we call it SMPC here. So this document actually clearly outlines the product's warnings, contraindications, and precautions. Another point is, of course, like clear labeling is important, because by using clear like patient information leaflets or even the carton packaging, you can ensure that patients understand how to use the product safely in the OTC environment, which is really important. Of course, as I said, all of these safeguards are key to mitigate all the risks and support the successful reclassification. And these are different points that you can discuss with the regulator, during a SAM meeting, for example, before doing your submission. Of course, you have on top of that the routine risk minimization measures that can provide the baseline for safety. So your continuous pharmacovigilance exercise to monitor adverse reactions as well. In the reclassification context, sometimes you will need additional measures. So as I briefly mentioned before, in the UK, for example, we have pharmacist training. It can actually support this. So the training is based on the SMPC, and it is proportional to the product risk profile. And training can actually take place, we've seen it taking place via different ways. So for example, it can be just handling hard copy material, it can be face-to-face training, or you can use online platforms to do so. However, what is key is that educational material must be practical, but not be promotional at all, and make sure that it is distributed across the different pharmacy networks evenly, so everyone has access. The other point that I mentioned was about checklists. So this is another valuable tool, but it's not mandatory in the UK. However, it helps guiding pharmacists through key questions to identify potential red flags. For example, does the patient has any potential pre-existing conditions? Or do we have any potential drug interactions that actually could deem the product inappropriate for the specific patient? The checklists are also based on the SMPC. So you can see that's why I started by making sure that you have a really good SMPC. And then it can also take different forms similar to the pharmacy training. So we have seen again, like the requirement for the patient to complete it in person at the pharmacy. We have seen any different like online pre-fill options. We have even seen like some scratch-off formats as well. So it's like there are different ways to achieve that. However, what it is key is that all these checklists should also be developed by cross-functional teams within the company. So you have to use your regulatory department, your PV department, and your medical experts as well. So as I said, while this is not mandatory, this approach can help standardize safe supply practices across the board. And finally, ongoing monitoring is really important. So we might have, for example, like post-authorization safety studies and potentially effectiveness check that will help confirm that whether the strategies that were decided before are actually working in practice. And actually, you can get feedback from pharmacists, but also other stakeholders as well, to refine materials and processes in a continuous way. So when it comes to the bit about misinformation, I believe that like consistent messaging across different materials and across different platforms, when we're talking about, online, face-to-face, together with close engagement with the regional regulators and pharmacy bodies is key. Because again, there is a lot of collaboration needed to make sure that like we prevent confusion to the consumer. We also have as PAGB our own communications team, but they play a vital role in addressing media issues. They also help correcting misinformation and promote the benefits of self-care through proactive engagement. Also, as PAGB and specific my team, we work directly with the UK medicines regulator when there is, for example, an instance of a potential ingredient issue, and we maintain established communication points to receive updates from MHRA on their view and their potential next steps as well, which is really important. And of course, on the other hand, as PAGB being the industry representative, we provide data and evidence to MHRA to support the regulatory assessment and making sure that the decisions are appropriate and so forth. So in summary, managing potential risks such as inappropriate use or misinformation after a product switch requires, as I said, a comprehensive, so all of the different points that I mentioned, but also a proactive approach. So you have to think about it while you're, and even before you start your official reclassification journey.
Thank you very much, Christina, for your insights. It was really enlightening to hear about the UK's best practices on OTC medicines regulation, which have hopefully inspired our audience today. So I will now open the Q&A. As I go through the questions, please continue to use the Q&A button to post your questions so that I can ask them to Christina or Ramez on your behalf. Okay, so first question we have is for Christina. How does the UK approach flexibility in channel access for OTC products?
Yes. So the UK enables consumers to access OTC medicines through a variety of channels. So first of all, we have, as I mentioned, pharmacies, which is really important, is our primary channel, and it also offers professional advice. You have your healthcare professional there, you have extended hours as well compared to the GP practices that we have here. And also it helps with like health and social inequalities, because we have found that over 99% of people in high deprivation areas are within a 20-minute walk of a pharmacy. So that ensures broad accessibility as well. So in addition to pharmacies, as I mentioned, in the GSL category, we also have supermarkets and retail stores that some medicines can be available. So that actually makes specific self-care options widely accessible outside traditional healthcare settings. So some supermarkets might be open, for example, 24 hours. And of course, living in a digital world, we have online platforms. So we have the online pharmacies, we have e-retailers as well that have expanded access and allows consumer to purchase all of the different OTC products from home, from the comfort of their house, and again, increasing convenience and choice. MHRA has done actually something really important in order to help mitigate, again, the risk of online suppliers. So you can actually go to MHRA website and paste a specific shop, the website address, and you can see if MHRA advises to buy from there or not. So that's actually a really useful tool that has been developed by the regulator and that help the consumers navigate whether the appropriate ways to shop online. And of course, as I mentioned earlier, all of the different points that I mentioned earlier, so the clear reclassification pathways, the collaborative work streams, the work on the Reclassification Alliance back in 2001, but also the recent work as well, supports to help identify medicines categories that are suitable for OTC status and actually ensure the safe and responsible access across all of these different channels, whether it is P, where appropriate, GSL, online, and so forth as well. Another point I wanted to make is about umbrella branding, because we also recognize that umbrella branding is a way to maintain and expand OTC products portfolios. It supports innovation, it supports flexibilities in how products are marketed and accessed, and it is really important in the self-care setting. Actually, as PAGB, we are working with MHRA at this moment because we believe on umbrella branding, because we believe that like reclassification and naming processes and clear naming and umbrella branding requirements would allow companies to introduce new products on the market, expand indication, and further widening access in an appropriate way as well.
Okay, thank you, Christina. So I think next I'm going to sort of pull two questions, which may be for both you and Ramez. So the question is, how is the growing focus on self-care influencing global approaches to OTC regulation and market access? And I guess we can pull with the other question, which is, how do you see self-care evolving over the next 5-10 years globally?
Ramez, do you want to start?
Yeah, I can maybe comment and more focusing as well on like Africa, or let's say that the region where we operate here. I think the the need and the focus of self-care, driven by people today, is actually putting a lot of the authorities on a situation or a status where they want to improve, modernize the regulations that actually control the OTC, perhaps make it faster to be available to consumer, having less requirements to make products available, especially a lot of OTC medicines are actually established molecules. Improving the channel and improving distribution through pharmacy, non-pharmacy, even online distribution and all of that. So I think we see a lot of changes happening around us in many countries around us in the region of Africa region. And I think it's this is influenced by the need of complementing self-care with responsible self-medication available to consumer.
Yes, and just to build up on Ramez, I believe that we have seen, and I believe that I gave you a flavor of our experience when it comes to self-care and how we can help the individual, the patient, the consumer, the regulators, the industry, and the healthcare systems as well. And I think that we are going to see a gradual move from being a nice to have to being recognized as a core pillar of healthcare globally, because it can save so much money from the already strained national health services as well. So we know that health services are strained from aging population. There is a rise in demand on workforce shortages as well, and self-care offers, let's say, practical and scalable solutions. So they're relatively easy to achieve. Of course, we also have the advantages in technology, which, we cannot ignore that. We see gradually changes in how people consume, but also how they consume information as well. So we believe the way that they will perceive self-care will also change. So we believe that in general, people will go and seek for trusted health information online. They will use apps. They will use tools to support self-diagnosis. They will track the symptoms. This information will help them guide through the different treatment choices that they have. And one thing that we have been saying as PAGB is we know that our members in the UK, because they have established websites, etc., it's a trusted source of information for the consumer, and the consumer will always go there to go and find the information needed. We also have the NHS app here that people can manage their health through that, and we have the NHS website that actually has different diseases and helps the consumer and the patient understand their options and whether they should go and visit the doctor, or whether there are any self-care options as well available as well. Also, I briefly mentioned the NHS 10-year health plan in the beginning. So this really big flagship document from the government has been published recently, actually showcased that there is a strong focus on prevention. There is a strong focus of moving the focus from hospital to community, whether we're talking about community pharmacy as well, and a lot of focus on digital. So you can see that we see that there is a total shift that actually really fits really well under the OTC and self-care as well. And we believe that these, in different scales will be mirrored globally. Another thing that we see is self-care to be embedded in education systems as well and public health strategies. So like children from very early age, they understand how they can take care of their care, their health very early on.
Yeah, thank you. Looking at the time, I think we have time for perhaps one more question. So there is someone who wants to know if for an OTC product, there will be an inspection conducted by the MHRA for site GMP, and secondly, the timeline for the approval of the OTC products. So I guess, Christina, this is for you.
Yes, so OTC medicines are regulated and managed exactly the same as prescription medicines. There is nothing separating them from RX apart from the way that they are supplied to the patient. So, the submission and the evidence should be they should support the quality, safety, and efficacy that you have to prove. It has to comply with all the different requirements, the pharmacovigilance requirements, the GMP requirements, like each and every other medicine. There is nothing different apart from the involvement of a healthcare professional and the level of involvement of a healthcare professional during its supply. So we're not talking about licenses, we're talking about access after the product is being licensed. Sometimes when you're doing a reclassification, depending on your company's objectives and strategies, you might want to keep your original product RX, and you might want to reclassify the product with, usually it is available with limited indications, with a limited product patient populations, or sometimes we have less tablets in there. So this is also part of your risk minimization measures, which is again product specific. So as you can see, the core requirements are exactly the same, are identical, whether we're talking about RX and OTC, basically. So the timelines. So the timelines depend on the type of reclassification. So for example, you could expect that if you have a big first-in-class reclassification application, you want ideally to do a scientific advice meeting beforehand. So that actually adds to the whole process, because you have to ask for it, you have to get a slot, etc. So this adds up to the time. We also MHRA had a backlog in the scientific advice meetings a couple of years ago, but now everything has been streamlined, so the process should be really straightforward when it comes to scientific advice meetings. And then depending on the type of reclassification, again, if it is a major for an innovative product or if it is a more simple one, it affects timelines. Usually, if you have a big reclassification, you will have the involvement of the Commission of Human Medicines in the process. So the case and the MHRA decision and assessment has to go through there and be discussed, etc. So there are other additional steps that have to be taken into account versus a similar reclassification. And I can share the guidance afterwards with the group as well, if you want to get into the detail as well. Sometimes, for example, again, for a major reclassification, you might need the involvement of specific expert advisory groups. For example, if you want someone, say that you want to reclassify something for this specific condition, you might want to talk about the specific patient groups and societies and stuff to gather evidence. And then I mentioned in some cases, we might have the public consultation as well. So the public consultation takes a few months. So again, it is an add-on in the process. The process was taking a long time a couple of years ago, but then we worked with MHRA really closely to develop the guidance and the flow charts and the checklists as well, in order to make sure that industry has as much information from the get-go as possible. The checklist was provided, so we worked with MHRA and we were like, okay, what are the common pitfalls? So when someone is like sending you or submitting an application, what are the common things that they are missing? Why don't we make a checklist in the beginning to make sure that everything you need is in there from the get-go, or if they're not, what is this justification available? So we believe that this is something that helped a lot. On the other hand, previously, a couple of years ago, we had the interaction between the assessor and the applicant was a lot stronger. So there was a lot of like back and forth, and etc. Whereas currently the process allows only 2 communication points, 2 RFIs that we call it request for further information. So on the one hand, so this is more than a normal interaction with MHRA at the moment. But on the one hand, we thought like that was not ideal because people want to make sure that they get things right. But on the other hand, we also see the potential of like, so when you have 2 points, you don't expect the regulator to raise new points during the process. It is one from the beginning and you just focus on addressing this going forward. So it is like a balanced approach. So yeah, just to summarize, it depends on the process. It depends on that has to be followed. It depends on whether you're gonna have a SAM meeting or not, and it depends on the innovations you want to bring on the market. But I'll share the guidance afterwards.
Which I think would be great because there was another question around what are the bases for reclassification, how can we assure safety, and I think that will also answer that question. So that's
absolutely
perfect. Okay, one last question for Ramez. So after hearing this UK model, where do you see Africa from this developed system, and what challenges you see for Africa?
For Africa, I believe that most of the African countries are somehow aware of what's happening in the UK and other developed countries, or let's say the more developed countries when it comes to the OTC system. And there is a willingness to make changes. There is a need they see from the people on the interest of self-care and how they can provide the facilities to do that by having a more established OTC system. I think the challenges is more about how are we going to give enough focus to work on developing those legislations to have a, let's say, a better and more responsible self-care system. And I believe it's a responsibility from the government and the industry and even people to work together to have that win-win situation in terms of like very well established system. My challenge as well, or like the challenge I see, is if they want to start everything from scratch, while there are a lot of so many successful models that have been tried over the last 20, 30 or 50 years, like the example of the UK. So maybe the way to look at it is like, why can't we just look at what was tried and we try and copy it or try and take the best out of it and start doing it in our countries and develop more on how the outcome that we'll see. But yeah, I see more that China. I see a promising future, to be honest. So it's yeah.
Great to hear. Thank you, Ramez. Okay, so we are close to the end now, and hopefully this has provided you with some good food for thoughts on streamlining registration process for OTC molecules and on regulatory flexibility in channel access and pricing. So with that, I will hand over to Ramez for final closing remarks.
Thank you, Aurélie. Thank you, Christina. Of course, I would like to thank you a lot on having that session. I would like to thank the AfriSummit organization for allowing us that opportunity for the webinar. I think it's uh, it's a very useful session that we just had. A lot of learnings on what's happening, let's say, at the example of the UK. And I'm really looking forward for the people who managed to join us today, many of you as well, to try and join the actual AfriSummit as well next month. And maybe we have more discussions. And I would say as well, like if anyone would like to have any more question, please feel free to share it and we will be happy to reply to you on that as well. Thank you very much.
Thank you.